Hi, Kristen. My name's Justin. I'm going to be doing your cardiac assessment, okay?
Okay.
Can you just verify your name and date of birth for me?
Kristen Murphy, 33086.
Okay. And before we get started, I just want to ask you a few questions. So, have you noticed any shortness of breath or dizziness?
Nope.
Any chest pain?
Nope.
Okay. Any cough?
Mm-mm.
How about when you're sleeping at night? Do you notice yourself waking up to go to the bathroom frequently?
No.
Or you're positioning yourself in certain ways to sleep so you can breathe better?
No.
Okay. How about any swelling in your feet or your hands? Your
No.
ankles? No?
Mm-mm.
What's your activity like? Do you exercise?
A couple days a week, yeah.
Okay, good. Have you noticed any fatigue while doing that?
No.
How about on a normal day? Any tiredness or fatigue?
No.
Okay, good. Do you have a family history of diabetes or diabetes yourself?
No.
Okay. And I am considering her age. She is 34 years old. And she's telling me that she exercises, so that lets me know she's young and healthy, which is helping to reduce her risk of cardiac disease. Okay, so what I'm going to do first is I'm just going to take a look at your neck. Okay, I'm going to look at the arteries and the vessels that are in your neck.
Okay.
Okay? All right, so go ahead and just tilt your head to the right for me a little bit. All right, so right now I'm looking for any jugular vein distension. I'm not seeing any distension. I can appreciate the pulsating of her carotid artery. Okay, go ahead and tilt your head to the left. Do the same thing on this side. Not noticing any distension. And again, I can see her carotid artery pulsating. Okay, and while I'm inspecting her, I'm just going to take a look at her skin. Her skin appears to be pink, warm, and dry. Her nail beds are pink in color, no cyanosis noted. Both hands are the same way, symmetrical, both sides. I'm also going to check her toes. Okay, nice pink nail beds, no cyanosis. Again, they're warm, indicating good circulation. I'm just going to take a look at her ankles. Not noticing any edema or varicose veins. Okay, there's no pitting. All right, great. All right, Kristen, so now what I'm going to do is I'm just going to feel the arteries and the blood vessels in your neck, okay?
Okay.
All right, so now I'm going to palpate her carotid pulse. Okay, I would call that a +2 in amplitude with a regular rhythm. Do the same thing on this side. Again, I'm noticing a +2 amplitude with a regular rhythm. Okay, I'm going to go ahead and just feel your chest here, okay?
Mm-hmm.
Now I'm going to feel for the point of maximal impulse. Okay, it feels regular. I'm not noticing any heaves or thrills, no vibrations. Okay. Then I'm going to go and just feel some peripheral circulation, okay? Brachial pulse on the left side. So regular rhythm, +2. Feel the radial pulse. Regular rhythm, +2 amplitude. Do the same thing on this side. +2 with a regular rhythm. Radial pulse. Okay, again, a +2 with a regular rhythm. I'm just going to feel your hips here, okay?
Mm-hmm.
I'm going to palpate the femoral artery. Okay, again, +2 with a regular rhythm. All right, both sides are +2 with a regular rhythm. Check the popliteal pulse. Okay, this side. I notice a +2 amplitude on both sides with a regular rhythm. Now we'll check the pedal pulse. Okay, again, I note a +2 pulse with a regular rhythm on both sides. All right, Kristen. So now what I'm going to do is I'm going to listen to your heart. I'm also going to feel your pulse in your hand and your wrist at the same time. Okay.
Okay.
So I'm just going to compare her apical pulse to her radial pulse. Okay, I measured that rate for a full 1 minute. The apical pulse and the radial pulse were in sync with one another, and I measured a heart rate of 73, the regular rhythm. All right, Kristen. So now what I'm going to do is I'm going to actually listen to your heart in a few spaces, okay?
Okay.
All right, so I'm going to listen to the aortic region. The pulmonic region. Both of these positions are just lateral to the sternum, and I can appreciate a louder S2 than S1 sound. Now I'll move down to Erb's point. And I can hear an S1 and an S2 sound, both around the same loudness. I'll move down to the tricuspid. And the mitral. And S1 sounds louder in these two positions. Okay, now I'll transition to my bell and listen to those regions again. So this time we'll start with the mitral. And then tricuspid. Move up to Erb's point. Some pulmonic valve. Then I'll move over to the aortic. Okay, and I could hear good S1, S2 sounds, no extra heart sounds, no splitting or clicking, no swooshing sounds. Now I'm just gonna listen to her carotids. to check for any bruise. All right, Kristen, I'm just going to listen to your neck, okay?
Mhm.
Hold your breath for me. Okay. This side. Okay, good. All right, and I didn't notice any swooshing or clicking in there. It sounded nice, pulsating sound for carotid artery. All right, Kristen, so now I'm going to have you lay on your left side. Now with her in the left lateral position, it kind of pushes her heart up against the chest wall a little more, and I can get a little better auscultation point of her apex. Okay. Sounds good. S1, S2 sounds. All right, Kristen, I'm going to have you sit up. All right, and then in the sitting position, it was again good S1, S2 sounds, no extra sounds, no splitting or clicking. S1 was more audible than S2. All right, Kristen, do you have any questions for me?
No.
Okay, that should conclude our assessment. Thank you.
Thanks.